Today we have a very important topic as our discussion, and that is an important topic from the tibiofemoral joint and patellofemoral joint which we had been discussing earlier. That is the patellar motions, the motions of our patella. And the motions of patella are very important to understand the biomechanics of patellofemoral joint. Not just patellofemoral joint, but even the tibiofemoral or the knee complex as a whole. This motions plays a very critical and crucial role in the proper kinematics of a knee complex. Do you know how many motions the patella can have? Do you know which axis and plane that motion is and the extent of that motion? If you wish to know the answers of that questions, stay tuned to this video, and today we are discussing the patellar motions in this video. Yes, we are going to discuss about the patellar motions. But I want to give you a general picture. We have here our femur, we have here our patella, and we have of course the tibia, a three-bone combination. And this is just making, or this just makes the motion a complex one, right? But need not worry, we will simplify it for you, right? This is making the joint motions a complex one. And of course, you know the patella is just like a floating bone. It's not having any rigid attachment, and it is just floating, or it is embedded in the quadriceps tendon. And of course, it has a slight attachment as the patellar tendon into the tibial tuberosity. It's not like any other joint in the body. So all these factors makes the motions of the patella a complex one, but we are trying to simplify it. Yes, let us step on to the motions. And when we discuss about the motions, we see that the patella can have the following motions. The motions of the patella include flexion and extension, the patellar flexion and extension, right? Very good. The second motion is lateral and medial tilt, lateral and medial tilt, right? Very good. The third motion is lateral and medial shift, shift, very good. And the fourth motion is lateral and medial rotation, lateral and medial rotation of patella. So it has about 8 different movements as a combination of 4 motions. That is a flexion bar extension of the patella, patellar extension bar patellar flexion, lateral and medial tilt of the patella, lateral and medial shift of the lateral and medial shift of the patella, and lateral and medial rotation of the patella. Here we are going to discover each and every one in detail. So let us first discuss about the flexion of the patella, patellar flexion and extension. Yes, for this scenario, we must imagine a situation where your femur is fixed, right? Our femur is fixed. And thus, what happens for the flexion? The tibia should go for its flexion. Now let us see what is happening. And of course, you have here your patella. Imagine my 2 fingers as the patella, okay? And now, what is happening? The femur is fixed, okay? We should have it in our mind. Now, when femur is fixed, how does the tibia move for the flexion? This is how it moves for the flexion. And now you know that this patella is attached to the tibial tuberosity via the patellar tendon, and it cannot move. Okay, it is attached there. It cannot break it and move away. So what happens when this tibia is going for flexion. Initially, let us imagine this was the position of patella above at the medial and lateral tibial femoral condyles. Now you see, when the tibia is going for flexion, what is actually happening to the patella? It is actually following that. It is actually following that flexion of the tibia, right? The flexion of the tibia, it is actually following. And in which direction tibia is flexing? It is going inferiorly. So the patella is actually, this is the base of the patella, okay? You see, imagine what is happening to the base of the patella. The base of the patella is coming down. That means patella is tracked down. Yes, the patella is tracked down. So let us see with this diagram. Femur, tibia, the neutral position, right? Very good. And femur again, tibia again, but in a flexed position. This was the initial position of the patella. We draw that line over here, but at this point patella comes down, because this is the attachment side that is going to pull it. This is the attachment side that is going to pull it. That means the patella is going for an inferior glide. Very good. The patella is going for an inferior glide. So in flexion, patella has an inferior glide. You might think, is it all about flexion? No, flexion is something bit more, but we are trying to build up from the basics. Inferior gliding of the patella. Very good, very good. But let me ask you, is it only an inferior glide of the patella? Because if it is a glide alone, it's a translatory motion. But we have a normal range of motion here. We have a rotatory movement over here. What is actually happening? Now let us build up this knowledge. Initially, you must imagine, you must think that the ultimate aim of the patella or the patellofemoral joint, it's not involving tibia, the patellofemoral joint, is that patella should ultimately come in contact with the intercondylar notch and sit inside it. When it sits inside it, this is stable, the total knee joint is stable. That's the ultimate aim of the movements of patella. Okay? Let us imagine that's the goal of patella's movement. And the femoral condyles is patella's friend. And it has to ultimately reach, or its home. It has to reach ultimately its home, that is the intercondylar notch. Now we have to think. Yes. See, the patella is placed over here. We are thorough with this one. The inferior sliding, inferior glide, we are thorough. Now we don't want to look on it. We have to think what is happening inside this at the same time. See, this is the initial position of the patella. And just closely observe when patella is going for, when tibia is going for flexion. What is happening? The patella is actually rotating around its femoral sulcus or the femoral condyles. It's not just pulled or dragged around. It is actually rotating around the convex femoral condyles. So that is actually flexion. The flexion of the patella is not just inferior glide. The flexion of the patella is downward rotation of the patella around the femoral condyles. If this condyles was a straight one, this condyles was something like straight. For example, if the condyles was something like this, okay, it would have been just an inferior glide. But that's not the situation over here. The condyles are convex and patella's friend or patella's ultimate aim is to be here. So it has to move with it. It has to move with it. So the rotation of the patella is actually what? It is inferior glide along with the downward rotation of the patella around the femoral sulcus or femoral condyles. Right? That's all about the rotation of the patella. So what can we define rotation of the patella? The most important point, let's try it with the running, that is, it is the downward rotation. Downward rotation plus this one, that is the inferior glide, or more predominantly it is a downward rotation of the patella. In which plane? Flexion and extension happen in which plane? The sagittal plane. The downward rotation of the patella in sagittal plane is known as its flexion, patellar flexion, right? If patellar flexion is clear, what can be patellar extension? The same opposite, the opposite thing of this. That is, here what will happen? The patella will go up. That is, when the patella is going up, what is happening there? Superior glide. Very good. Superior glide. If it is inferior, the opposite, superior glide. This is downward rotation, that is the upward rotation. Superior glide plus upward rotation of the patella in the sagittal plane is known as patellar extension. Very good, very good. We cleared patellar flexion and patellar extension. Let us just have a quick go through to the patellar extension. See, this is a flexed position. Okay, now patella has to go for extension. It is going for superior glide. This is glide, but along with that superior glide, see, this is actually rotating. It is actually upwardly rotating around this femoral condyles, around this femoral condyles. That is the flexion and extension of the patella. Only thing that is complicated on this movements of the patella is actually flexion and extension, and we covered it, right? Should I explain it once more? Yes, let us have once more. Let's have a quick go through once again. That is, during flexion, it is the inferior glide. Very good. Inferior glide. Patella is being distracted inferiorly. But along with that, it is going for an downward rotation around the femoral condyles. Downward rotation around the femoral condyles. Downward rotation around the femoral condyles. That is actually the flexion. And extension is an upward movement, upward glide or superior glide along with upward rotation around the femoral condyles. In flexion, ultimately it reaches this follows and it ultimately reaches the femoral condyle or intercondylar notch, and it finally rests over there. Okay, right? This is actually happening because of two factors. If you want, I can tell you, but if you are getting complicated, forget it. Okay, that is because you know that this lateral tibial condyle is a bit anterior. One is that, and you know that extension last 5 degrees is the locking. Locking means it is laterally rotated. Okay, the tibia is laterally rotated. Now for flexion to happen, it should go for medial rotation. So tibia itself is medial rotating, so the patella also will follow it, and that is what results in the patellar rotation. That is, and the patellar flexion too. That is happening in the patellar flexion and patellar rotation too. If that is complicating you, just forget that. Just get what is the essence. Yes, we did for the first one. That is, we cleared flexion and extension. And now we are moving to the second motion. That is medial and lateral tilt. Medial and lateral tilt of patella. Right? If this is a piece of paper, or this is something, this is the patella, or anything which has a surface area like this. Remember, flexion and extension is happening in the which plane? That is a sagittal plane. Yes, this one, this is its flexion and this is its extension. Or this can be known as tipping, or this can be known as tipping. Okay, fine. And this is the lateral shift. If this is shifted to this one, shifted. If it is shifted to this one, shifted. Okay, lateral shift, medial shift. Okay, fine. If it is rotating, if it is moving like this, okay, around the axis, that is the rotation. Now what is tilting? Now what is tilting? Tilting is this one. This one is straight like this. It is turning like this. It is turning to one side. It is not moving to one side. It is actually moving plus a slight turning to one side. That is a tilting. This is the lateral tilting. If this is the lateral side, if this is the medial side, this is the medial tilt. But I'm not going to stop my explanation with this, but we are going to see it. So just understand what is tilting initially. And now we have here your femur. Yes, very good. We have our femur here, and we have our tibia over here. Yes, good. And what we need the patella, right? Yes, let us draw the patella. Yes, the patella is resting over here like this. It's resting over here like this. Yes, very good. It's resting like this. Okay, good. Now, what is medial tilt and what is anterior tilt? Tilting is often always referred or given as the reference point is taken as the anterior surface of the patella. I told you patella is having two surfaces, that the anterior and posterior surface. This surface of the patella is known as the anterior surface. So the movement of the anterior surface is always taken as the reference point for tilting movement. And this is the lateral femoral condyle, this is the medial femoral condyle. Okay, now first one, let us take the lateral tilt of the patella. What is happening for the lateral tilt of the patella? The patella actually moves, tilts to the side. Tilt of the patella. You have patella over here. Yes, this patella reaches around this side and it moves in that direction. When the same patella moves to this side and this tilts in this direction, this is known as the medial tilt of the patella. See, can you understand? That is, the patella is here initially, it is moving over here, and at the same time it is tilting diagonally. It is moving in this direction. That is known as the tilt of the patella. If it is tilting to the medial direction, it is known as the medial tilt. If it is tilting to the lateral direction, it is known as the lateral tilt of the patella. Right? So we have another motion which is the medial and lateral tilt of the patella, and this is taken as the reference point anterior surface. Now let us define it. The medial tilt of the patella is the movement of the movement of the anterior surface to the medial femoral condyle, right? It is a movement of the anterior surface to the medial femoral condyle. And this is the movement of the medial anterior surface to the lateral femoral condyle. So let us define it. What is medial tilt? It is movement of anterior surface to the medial femoral condyle. Okay. What is lateral tilt? It is the movement of the anterior surface to the lateral femoral condyle. Is that all? No. No. Yes. Medial tilt is also, here it is the patella. This is the medial edge of the patella. Okay, this is the lateral edge. This is the lateral edge of the patella, and let it be the medial edge of the patella. So what do you mean by medial tilt? The medial tilt is actually the movement of the medial edge of the patella to the medial femoral condyle. More clear definition. And what is here? This is the lateral end of the patella. Okay, lateral edge of the patella. So what is lateral tilt? It is a movement of the lateral edge to the lateral femoral condyle. So let us advance. Let us add on to our definition. What is medial femoral tilt? What is medial tilt? That is the movement of medial edge of the patella. Medial edge of patella to medial femoral condyle, right? Yes, very good. And what is lateral tilt? That is the movement of lateral edge of the patella, to lateral femoral condyle. See, that is so simple. Let us once again see that. Yes, what do you mean by tilting motion? A tilting motion is not just a translatory motion like this, but tilting is a change in direction like this, a change in direction like this. So if this is the medial condyle and if this is the lateral condyle, whatever it is for reference sake, okay, what happens? Now patella has to tilt medially. The patella moves to this direction and changes its direction like this. That is the medial tilt. Now patella moves to this direction and changes its direction or tilts to lateral side. When it is tilting to the lateral side, it is a lateral tilt of the patella. When it is tilting to the medial side, it is a medial tilt of the patella. And for definition, the anterior surface of the patella is taken into consideration. We don't look into the posterior surface, then everything will go wrong. Right? So, the medial tilt is the anterior surface moving to medial femoral condyle, or more clearly, the movement of the medial edge. You know that this is the patella. If this is the patella, right? This is its. It can be its medial edge. This can be its lateral edge, and you know that here you have the groove which divides medial and lateral condyle. So it is a medial edge moving to medial condyle. This is the lateral edge moving to lateral condyle. That's all about the medial and lateral tilt of the patella. All right. I hope that is clear. And now next one that we have is medial and lateral shift of the patella. Shift. Actually, medial and lateral tilt is occurring in which axis? The longitudinal axis is actually occurring in the longitudinal axis. Which was that movement? Medial and lateral tilt. Now, the medial and lateral shift. Shift means what? Shift means just change in position. Just change in position. So, medial shift of the patella means the patella changes to the medial femoral condyle, or patella moves close to the medial femoral condyle. And if this one moves close to the lateral tibial condyle, that is the lateral shift. And you know by this is a translatory motion. This is not a rotatory motion, it's a translatory motion. So what is medial tilt? Medial shift? Medial shift is movement of the patella to the lateral medial femoral condyle. What is lateral shift? It is a movement of the patella to the lateral femoral condyle. Just movement. Patella as such is taken and placed over here. If this is two bones, if it is shifted, this bone will be moving away from it. This one will be moving away from it. Okay, that's just a shift. Okay, now we got medial shift, lateral shift, medial tilt, lateral tilt. Tilt, this is happening. This is happening. A turning in the direction is happening. Shift is just a translatory motion. And this one, you know, it is happening in which plane? Which is this plane? That is the frontal plane, right? If it is a frontal plane movement, which axis should it take place? Think on it. Right, yes. And finally, we move on to the last motion of the patella. Let us move on to the last motion of the patella. Right? What is that? That is medial and lateral rotation of patella. Medial and lateral rotation of patella. Yes, the medial and lateral rotation of the patella. I told you from my example of this a paper or the patella. Rotation means this is the rotatory movement. Now let us imagine what is happening in rotation of the patella. Okay, let us draw our tibia. Let us draw our femur. Let us draw our tibia, and we have here our patella resting. Yes. And now we need to see what is medial rotation of the patella, and now we should see what is lateral rotation of the patella. Are you ready? Yes, let us do it. And to define the rotation of the patella, we have the patella over here. Let us have the patella over here, right? This is its apex and this is its base. Earlier for shift and tilt, we had the reference point as the anterior surface. And for the rotatory movement, we take its distal apex as the reference point. And for example, if this be the medial and this be the lateral, or this be the lateral and this be the medial, whatever it is, our reference point is the apex. So medial rotation means what? What does medial rotation mean? Medial rotation means the rotation of distal apex to medial femoral condyle. Very good. Medial femoral condyle. Always it is moving to the medial femoral condyle. The rotation of the distal apex to the medial femoral condyle. Now let us see how it can be done. If this is moving to this, if it is being translated to this direction, not just the medial femoral condyle, the not just the distal apex but its base also will do. If it is moving like this, the apex will move to the femoral condyle, at the same time base will also move to the femoral condyle, right? That's not happening. That is just, what is that movement? That is the shifting movement. Now we need to see what is actually rotation. In rotation, only the apex is moving and the rest of the part of the patella will move away from the medial femoral condyle. That means in rotation, medial rotation, the apex moves near to the medial femoral condyle, whereas the base moves close to the lateral tibial condyle. Is it clear? Is it clear? Always the reference point is your apex. What happens in medial rotation? If this is the medial direction and this is the lateral, this apex should move to this direction. And when something is placed over this, it is rotating. What should happen? If the apex is moving to this direction, this, see, the both top end will move to the opposite direction, right? So in medial rotation, we have the apex moving to the medial femoral condyle and its base is moving close to its lateral femoral condyle, right? That is the medial rotation. Now let us see what can be the lateral rotation. It is very simple. In lateral rotation, your apex will move close to the lateral femoral condyle, whereas your base will move close to the medial femoral condyle, right? That is, in lateral rotation, the reference point is your apex, okay? And the same consideration, this is the lateral side. If this is the lateral side, if this is the medial side, and you have, this is your patella, it should rotate to the lateral side. Always the reference point is your base. The base rotates like this. See, my base reached the lateral femoral condyle, but where did my apex go? It went, my apex reached the lateral femoral condyle. Where did my base go? The base went to the medial femoral condyle, right? Yes, very good. That is, one goes this direction, the other goes other direction. The rotation and lateral rotation of the patella, we defined it. Medial rotation is the tip or the apex of the patella moving towards the medial femoral condyle in this manner. And lateral rotation is the apex moving towards the lateral tibial condyle, lateral femoral condyles. Yes, that's all about the movements of patella. And you know, always these movements happens in a spontaneous manner or in a constant manner, in a rhythmatic manner, because patella is always attached to the tibial tuberosity via the patellar tendon, right, or patellar ligament. So when the tibia is going for medial rotation, the patella will also go for medial rotation. Yes, the tibia is going for inflection. What is happening? In flexion, tibia is actually going for an initial medial rotation. The patella will follow it. When tibia is at extension, tibia is going for lateral rotation. The patella will follow it because patella is attached to the tibial tuberosity, right? Yes, that's the motions of patella. That are the rotatory motions of patella. And we just need to know two more motions, that is the translatory motions of patella, which we had already discussed. One of the translatory motion is this one, take and move to the side. That is the shift, medial and lateral shift. The other one we already saw, the patella is tracked down. That is the superior and inferior glide. So patella is having the above translatory motion, that is a superior and inferior glide, which is happening during flexion, right? And the shifting movement, which can occur along with a slight degree of tilt, but it is actually happening an independent motion. So these two translatory motions are also possible in the patella. Now we need to understand that during the knee motion, for example, in flexion, tibia has to, when tibia is going for medial rotation, patella has to go for the medial rotation. Always the movement of the tibiofemoral joint takes place in association with the patellofemoral joint, and both of them clamps together. If there is somewhere some problem, it is going to be affected a lot. It is going to cause a lot greater problems. For example, in extension of the knee, if patella is not going for superior glide, we saw it should go for superior glide. The translatory motion is not happening. The quads will not be able to function properly because this patella is acting as a momentum, increasing momentum and anatomical pulley for the quads. If that's not happening, the quads cannot do it efficiently. Quads cannot work efficiently. For example, in flexion, the patella is not coming down. The patella is not going for inferior translation. We cannot achieve full range of motion. Similarly, in medial rotation, if patella is not going for medial rotation, that will cause problem. If it is not going for medial lateral rotation at the case of locking of the knee, again, that is going to be a drawback. So always understand the motion in knee complex as a whole involves the patellofemoral and tibiofemoral motions, and tibiofemoral motions are achieving its perfection with the help of this patellofemoral motion. And patella, even though it's just a small sesamoid bone, it has a diverse role to play and a crucial role to play. And in next session, we will be discussing a patellofemoral joint stress and various other applications. Until then, stay tuned. And if you like this video, don't forget to click the like button and kindly subscribe to our channel so that you are updated with all the future updates in this channel.